Picture this. Your blood pressure cuff shows 152/94. Your doctor is talking about adding another medication, and sitting right in your own chest, completely free and available every moment of every day, is a physiological mechanism that clinical research now shows can drop your blood pressure by as much as 9 points in 6 weeks, without a single pill. A double-blind, randomized controlled trial published in the Journal of the American Heart Association found that a specific breathing technique, done for just 5 minutes a day, lowered systolic blood pressure in adults aged 50 to 79 by an average of 9 millimeters of mercury. That is a result that matches or exceeds many first-line antihypertensive medications, and researchers at the University of Colorado who conducted the study described the adherence rate as remarkable. 95% of participants completed every single session. When was the last time 95% of patients stuck with any prescription that well? That is what we're covering today. Exactly how to use your own breathing to lower your blood pressure, backed by some of the most compelling cardiovascular research of the last 5 years. I'm Dr. Anthony Miles, and this channel exists to bring you the latest evidence-based health research explained clearly and practically for adults over 60. If you haven't subscribed yet, please do that now. Next week, I'm covering the 5 warning signs that your blood pressure medication may actually be raising your risk of falls. And that one is critically important if you're currently on treatment. Now let's get into the breathing techniques, because there are actually 2 distinct approaches here, and they work through completely different mechanisms. And most people who try breathing for blood pressure are only doing half the picture. Before I explain the techniques, I want to make sure you understand why this works at all. Most people assume breathing exercises are just relaxation tools, something for a yoga class, not a medical intervention. But what's actually happening when you slow your breathing down deliberately is profound. Your body has a built-in pressure regulation system called the baroreflex. There are sensors embedded in the walls of your aorta and your carotid arteries. Those are the large vessels in your neck and chest. And these sensors continuously monitor blood pressure and send signals to your brainstem to make adjustments. In people with hypertension, this baroreflex system becomes sluggish and desensitized. It stops responding as quickly or as effectively. Slow, controlled breathing directly stimulates these pressure sensors and essentially recalibrates them. It also shifts your autonomic nervous system from its sympathetic state, fight or flight, the stress response that constricts blood vessels and raises heart rate, toward its parasympathetic state, which is rest and digest, the mode where blood vessels relax and heart rate settles. And there is a third mechanism that connects directly to what we discussed in an earlier video about beet juice. Slow, diaphragmatic breathing increases nitric oxide production in the cells lining your blood vessels. Nitric oxide is the signal that tells your arteries to relax and widen. You are essentially triggering the same biological pathway that blood pressure medications target, using nothing but the mechanics of your own breath. Now, the first technique is what I call the immediate technique. This is the one that can produce a measurable drop in blood pressure within 60 to 90 seconds. It works best right before you take a blood pressure reading, during a stressful moment, or anytime you feel tension building. The technique is called slow-paced breathing, and the protocol that the research consistently supports is 6 breaths per minute. That translates to a 5-second inhale through your nose, followed immediately by a 5-second exhale through your mouth. No holding. No pausing, just a slow, smooth 5-count in, 5-count out, continuously for at least 60 seconds, and ideally for 5 minutes if you have the time. A meta-analysis published in the journal Mindfulness in 2024 synthesized 31 studies involving over 1,100 participants and found that slow-paced breathing at this rate produces significant immediate reductions in systolic blood pressure. A 2024 study published in Frontiers in Physiology, in which participants guided their breathing to 6 breaths per minute using a wearable device for 15 minutes before bed each night, found an average systolic reduction of 4.3 millimeters of mercury over several days of consistent practice. And a landmark study published directly in the journal Hypertension the American Heart Association's flagship blood pressure journal, found that slow breathing at 6 breaths per minute measurably increased baroreflex sensitivity and reduced sympathetic nervous system activity in hypertensive patients. Comment below and tell me, have you ever tried any kind of slow breathing for your blood pressure? Yes or no, and what happened? I ask because a lot of seniors in our community have been told by their doctors to relax and breathe during readings, but nobody has ever explained exactly how and why it works. Now you know the mechanism. Here's what most people get wrong when they try this technique. They breathe too shallowly. The 5-second inhale should be diaphragmatic, meaning your belly should expand outward, not your chest rise upward. Here's a simple test. Place one hand flat on your chest and one on your abdomen. When you inhale, the hand on your belly should move out first and more significantly than the hand on your chest. If only your chest is rising, you're breathing from the upper lungs, which engages the accessory respiratory muscles and actually activates a mild stress response. You want the belly to lead. Deep, slow, belly-first breathing is what activates the vagus nerve, the main highway of the parasympathetic system, and that's what translates into lower vascular resistance and lower blood pressure. Excited. But here's the part of this conversation that most health videos never get to, and it's where the science becomes genuinely exciting for people dealing with persistent hypertension. Slow-paced breathing produces real, immediate reductions in blood pressure. But the University of Colorado research discovered something different and even more powerful, a form of breathing that acts more like physical training for your cardiovascular system, producing sustained structural improvements in blood pressure over weeks, not just minutes. It's called inspiratory muscle strength training, or IMST, and the results published in the Journal of the American Heart Association stopped the cardiovascular research community in its tracks. Harold was 67, recently retired, and had been on lisinopril for 3 years. His systolic readings were hovering around 136 to 141 despite medication and what he considered a pretty healthy diet. He was frustrated and, honestly, scared. He didn't want to add a second drug. When I explained the University of Colorado IMST research to him, he was skeptical. Breathing exercises. 5 minutes. No equipment cost beyond a handheld device. He gave it 6 weeks. At his follow-up appointment, his resting systolic blood pressure had dropped from 138 to 127. His cardiologist reduced his lisinopril dose for the first time in 3 years. Harold's exact words to me were, "I thought you were pulling my leg." What the University of Colorado research team found was this. 36 adults between the ages of 50 and 79, all with systolic blood pressure of 120 or higher, were divided into 2 groups. One group performed high-resistance IMST, 30 powerful inhalations per day against significant resistance, taking approximately 5 minutes, 6 days per week. The other group performed a sham version with low resistance that didn't provide the therapeutic stimulus. After 6 weeks, the high-resistance group showed systolic blood pressure drop from 135 down to 126 millimeters of mercury, a 9-point reduction. Diastolic pressure also decreased modestly. Blood markers showed improved nitric oxide bioavailability and reduced oxidative stress in the vessel walls. And the most remarkable finding, even 6 weeks after participants stopped the training entirely, roughly 75% of the blood pressure reduction was still maintained. This is not a temporary dilation effect. This is structural cardiovascular adaptation, the same type of lasting change produced by regular aerobic exercise, achieved in 5 minutes a day at home. One finding deserves special attention if you are a woman past menopause. The research showed IMST improved vascular endothelial function, the health of the inner lining of your blood vessels, just as much in postmenopausal women as in men. This matters because previous research from the same laboratory had shown that postmenopausal women who don't take estrogen often fail to get the same vascular benefits from aerobic exercise programs that men do. IMST appears to bypass that limitation entirely. Now, what exactly is IMST and how do you do it without expensive clinical equipment? The technique involves inhaling powerfully through a device that creates resistance. Imagine trying to breathe in strongly through a straw that pushes back. That resistance forces your diaphragm and the muscles between your ribs to work at high intensity against a load, which is exactly the training stimulus that produces the cardiovascular adaptations. You are, quite literally, strength training your breathing muscles, and those adaptations cascade through your entire cardiovascular system. A device called the Power Breathe is what the University of Colorado study specifically used. It's commercially available online and at some medical supply stores, typically ranging from $30 to $60 depending on the model. You search for Power Breathe Inspiratory Muscle Trainer, and you'll find it on Amazon and similar retailers. If budget is a concern, other inspiratory training devices on the market at lower price points can also provide resistance, though the specific pressure levels used in the research required a calibrated device. The lead researcher at Colorado was clear: the resistance level is the critical variable. The relaxed breathing you do naturally doesn't get close to the therapeutic stimulus. You need a device that provides genuine resistance to inhalation. Here is the exact protocol from the published research. 30 inhalations per day, done in 5 sets of 6 breaths, with 1 minute of rest between each set. The entire session takes approximately 5 minutes. You do this 6 days per week, taking 1 day off. In the study, participants started at 55% of their maximum inspiratory effort in week 1, progressed to 65% in week 2, and maintained 75% from week 3 through week 6. If you're using a calibrated device like the Power Breathe, it will guide you through this progression. Participants in the study did their sessions seated in a comfortable chair at home while watching television. Adherence was 95%. This is not a grueling protocol. For the slow-paced breathing technique, do 5 minutes every morning before you take your blood pressure reading, and again any evening when you feel stress or tension. Set a timer, sit upright, one hand on the belly, 5 seconds in through the nose, 5 seconds out through the mouth. 6 breath cycles per minute. Let the belly lead the movement. A few safety notes that are essential. If you have any chronic lung condition, COPD, emphysema, or severe asthma, speak with your pulmonologist before beginning IMST, as the high-resistance inhalations place significant demand on your respiratory muscles and may not be appropriate without supervision. If you are on blood pressure medications, do not stop or adjust them without your doctor's guidance, even if you see your readings improve. The goal is to give your physician new data and let them make informed adjustments. Some people feel mildly lightheaded during the first few sessions of slow breathing. If this happens, reduce your breath duration slightly and build up gradually. And if you experience chest tightness, shortness of breath beyond mild exertion, or dizziness that persists after stopping, discontinue immediately and contact your doctor. The evidence here is clear and compelling. 2 breathing approaches: slow-paced breathing at 6 breaths per minute for immediate pressure relief, and daily high-resistance inspiratory muscle training for structural cardiovascular adaptation are among the most evidence-backed, non-pharmacological blood pressure interventions now available to older adults. One costs nothing and can be done anywhere. The other requires a modest device investment and 5 minutes a day. Both are grounded in peer-reviewed research published in leading cardiovascular journals, and both address the root biology of hypertension rather than simply masking its symptoms. Before you close this video, comment one of 3 things. Comment: trying the breathing today. If you're going to try the slow-paced technique right now, comment your current blood pressure reading, if you know it, so we can track where our community is starting from, or comment, need the IMST device, and I'll pin a comment with exactly what to search for. If this was helpful, subscribe now. Next week's video on blood pressure medications and fall risk could be one of the most important things you watch this year. I'm Dr. Anthony Miles. Your lungs have been there your whole life. It turns out they've been waiting to help your heart.